I expected from UNC's mentoring program is maybe almost a glorified work buddy, somebody who I could use as a resource just at work, so that I would kind of have a designated person I could ask questions to. But what I've gained through David is really invaluable. He's helped me through my first year as a nurse, my first year as a nurse in intensive care. He's really helped me develop not only my skills, but helped me develop goals, both at the hospital and outside of the hospital. He's been a great resource, and I think we have almost a symbiotic relationship. We've grown to be friends, and we help each other in our practice.
My name's Carlin, and I would like to share some of the experiences that my mentor and I were able to do thus far. We went to the heart conference together back in February, which was a great experience because not only were we able to learn important things from surgeons and nurses from other units, we were also able to be a part of the Heart Center Conference by sharing our experience on the Relationship-Based Care Committee. And we were able to share our family experiences with our patients and how it's important to us and how relationship-based care is important. And it was really neat to be able to do that with my mentor because it shows both of our initiative, and it made me really feel like a part of the team, which I feel is important coming in as a new grad. Other things that we've done, we've gone out to eat together. We'll just go and chat and talk about life in general. We're both young, newlyweds, so it's just fun just to talk about things outside of the unit. We also have gone to Kiowa, South Carolina, with some of the other people on our unit, which is kind of like a girls' night out, and it kind of helps relieve some of the stress and just kind of feel like you're part of the team. Definitely mentor-mentee experience have been personal and professional, which I think is important to have as a new grad coming into a team who's been together for quite some time. It just makes you feel like you're a part of the team and you're just as important, and your feelings are normal, and you're growing as a nurse the way that you should be.
My name is Lisa Clayton, and I think one of the biggest challenges of being in the mentor-mentee program, despite its many benefits, is that working a schedule of a nurse causes you to flip-flop your schedule. When you work 3 days, your mentor, your mentee may work the opposite 3 days of the schedule. So just finding time to meet with your mentee or mentor was somewhat of a challenge. Being both a mentee and a mentor, I see challenges differently, but I think the biggest challenge that I had as a mentee was, is it really okay to say how I feel when I'm speaking to my assistant nurse manager? It was a little intimidating for me to have my mentor be my manager, which I think in the end worked out great because he was full of knowledge, knew our unit front to back, every policy, was able to guide me and form me into a great nurse. But at the beginning, if I had a challenge or question about something, I was like, is it really okay for me to be able to question that, being that he was one of my managers and also my mentor. But overall, I think the program's wonderful. Being a mentee, I felt like knowing my mentor gave me someone who'd been established in the unit. Everyone knew this person. He was a leader in our unit. And now on the flip side, being a mentor, it's great to say, I really know my mentee, and she is doing an awesome job. And now that I've made all these good relationships and found my niche in the unit, I'm able to do the same thing for her. So it really just bridges that gap of that first year where you know what you're doing, you're gaining your confidence, but you're not as quick or not as confident as people who've been there for a while. So I feel like this program has a lot to offer, and despite its challenges, I think that they're very minor in compared to the benefits that one would receive from participating.
One of the most meaningful experiences that I've had during the mentoring program has been to watch the new grads or new ICU nurses transition from a novice nurse, during their orientation into a staff nurse, taking ownership of their job and their role, and watching them realize, hey, I'm a real nurse now. No one's watching over me, even though you're there as a mentor and frankly, all the other staff, but you're there as their mentor to support them, and they still come and ask questions, but they know, they're aware that they're the nurse, and you just see them, kind of branch out and a light bulb go off and be like, hey, I'm a real nurse, and that's a nice feeling, watching people grow into their career.
My mentee came to me wanting to know what kind of project he could do to better his bedside practice. And after we talked a while, we came up with how could we best utilize the open chest cart in our unit? Not everybody's familiar with it. So he and his new nurse graduate friends decided to come up with a project that would ultimately affect the whole CTICU, and that was coming up with the open chest cart program, making it a little more efficient to use. And since they did put this program together, we have been able to use it multiple times very effectively. It makes it a little easier to use. I don't want to say it makes it more fun to use, but because they put some time and energy in it, it has affected all of us.
My experiences with the mentor-mentee program have come both from the perspective of being a mentee as well as being a mentor. In regards to concerns that I had with this program, as a mentee, I selected my mentor as one of the nurses on the unit that I wanted to strive to be like. I found his clinical knowledge and expertise was just inspiring, and I wanted to become that practitioner. So going into the mentor-mentee relationship, I just had a concern that maybe I wasn't going to be able to achieve that. Maybe I'd set the bar too high. Maybe the shoes were too big to fill. Our relationship, kind of developed, and he really helped to push me to become a better practitioner, which helped overcome some of those initial concerns. When I was asked to become a mentor to a new nurse, that just brought on a whole nother set of challenges and concerns that I had. One of which was that, was I ready? Did I possibly know enough to guide a new nurse through their early development to become a very competent RN? So that quickly became apparent. I think one of the beautiful things of this program is that as you as I transitioned into the role as a mentor, you do begin to reflect back and see how much you have grown through the program. And that happened exactly for me. I was able to see just, wow, I do know a lot in the, by the bedside. I am a very competent practitioner. I developed into that nurse that I wanted to be, and I am able to help guide a new nurse on that journey. So that's kind of been the biggest concern in how I've kind of found my way, worked through it.
For me, I'm in a little different thing. Being there for 18 years, that's been my goal, is to be at the bedside, be a nurse. A lot of people come in with wanting to be nurse anesthetists or nurse practitioners. So my mentoring is going to be tough in that I can't give them advice on how to get there, what it is to be there. But yet, I always felt like I could teach them or show them a good way to be a bedside nurse, learn how to take care of the patients that would help them in their experiences later on when they went on to do something else. They'd always have a good base to take with them. And that's always kind of the way I've felt with new nurses, is teach them a good way, let them learn, and when they go on to whatever they want to do, they'll be well experienced.